Hi, now this is Sauba presenting. Today we are going to check on maternal newborn care, having in mind that that is what we are having in medical student arena, a online examination for Monday. Tomorrow being on Monday. So today I'm going to take you through the preconception care under maternal and newborn health. And actually, this is a unit which is studied by nurses who are either doing, be it degree in nursing or diploma in nursing. So maternal newborn health is just a unit that entail the mother and the child, their health that is from the conception up to delivery of a child, and even after the delivery of a child during the postnatal care, the neonate, toddler, school-going child, upwards up to adolescent. So today we are going to check on preconception and get in mind that preconception care is what is going to be tackled in tomorrow's exams. So you'll always be reminded to keep session in our YouTube channel and follow us so that when you do the next day exams, you are actually prepared. So on the preconception care, key thing here, preconception word that comes from the meaning preconceive, before mother conceive, what's supposed to be, like what is the categorical knowledge that this was supposed to be sensitized on. And the definition of conception care is just a set of interventions that identify and modify the the biomedical, behavioral, and social risk to a woman health and future pregnancy. So this is how the mother is supposed to be taken care of in terms of waiting for conception or maybe before conception. So it includes the health promotion, prevention, and management of any pre-existing condition. Because as we know that human body is, it's actually at a risk of the valve condition that can come in line with living. Like it can be it's sensitizing in terms of how the mother can be healthy in a way, or they can prevent themselves from getting any disease. And if there is already a disease, how it can be managed so that it cannot impact on pregnancy in a negative way, but in a positive way. So we talk about the preconception care being done on reproductive age, that is 1549. But you know very well that the late teen is when the reproductive age is at peak, that is up to 20 to 25 there. So assume from 18 to 25, you are very many, most women are productive. Then as you go from 30, that declines, okay? The fertility declines, and from 35 now you're welcoming menopause. So that bracket of 15 to 49 years is not such a big, sport, but something that shall just be, yeah, get her to know. So let's see, why do we have to do preconception care? First, to provide health promotion education to improve knowledge. Remember that we have mothers who are still in Transmara, Sakwabondo, Kadungo Hera. We have mothers who are still in Game. We have mothers who are still in Bungoma, those interior Busia border. Okay, we still have ones who are still in Laini, Gatoka, Dakaini. Some of these parents in Africa or maybe in Kenya in specific, they really need this information because some are still depending on the traditional. This assistant, the traditional delivery guy, the mothers, kunga. So first, to provide evidence by screening for pregnancy risk, they should be known if at all there's any risk to pregnancy, be it condition, maybe even, ladies who are not yet mature for pregnancy. To provide intervention to address identified risk and condition to achieve universal coverage essential for obstetric. So reproductive health risk include the following one if you're very young. So age is a factor, parity is a factor, nutrition status, low socioeconomic status, and previous adverse pregnancy outcome. So these are all risks including so the first one, age, when you're very young, that is around 16 years and below. Very young, 16 years and below, you're not potent enough for for 9 months gestation period, like to carry pregnancy. Maybe your sacrum is not that mature. Okay. So, and also if you're elderly, that's 35 years and above, that's also a question. 35 years and above, your uterus, the endometrium wall, the myometrium cannot actually afford to contract continuously as it is supposed to be during delivery. So even pregnancy 9 months can be so tiresome, and you see with 35 years already welcoming some age related condition. So parity is another thing. Primary gravida parity is how many times mothers actually delivered. Okay, is it the first time? We have gravidity and we have parity, so you don't mistake those two. So primary gravida, the premier, the first pregnancy set. Okay, gravida is the number of pregnancy, parity is a sexual birth. Those are actually viable. So primary gravida, this first pregnancy, grand multiparity has got several children, short interpregnancy interval. So those ones are supposed to be assessed because those are the health risk. Okay, yeah, if somebody is on the first time pregnant, that is very risky. So it's supposed to be very key intervening. Grand multiparity, I mean, this one is having more than once or twice or three eyes in delivery. So that is also something to consider as a risk. Nutrition status, under nutrition, the mothers who take the whole day with chewing sugarcane, they come from, low socioeconomic status, that is poor individuals. Yeah, during pregnancy there's some essential minerals and part of diet that is actually considered to be very, very, useful in nutrition. So like when they're undernutrited, the baby will not get enough nutrient for development, because embryogenesis requires a lot from the mother side. Obesity, people tend to gain more than enough weight. That is obese when you measure obesity in terms of the BMI, that is body mass index. Okay, okay, so you're gonna get to realize that above 30 we start to know that this guy is obese. But now obesity comes with a lot of things. We'll have more fat, adipose tissue, lipids. We'll have metabolic diseases coming into play, hypoperfusion, maybe let's say just oxygen depth due to maybe hypoperfusion or cardiovascular condition like pressure. Okay, so with mothers who are obesity, you get some of them are diabetic, or some they have what this lifestyle condition. So the baby is also at risk, because the consequences of diabetes in a pregnant mother result to many things. Sometimes you get to realize that even macrosomial state, the baby is born with a lot of other complications. Okay, can have even, prolonged labor and all that. So malnutrition comes into play. Malnutrition also, if somebody is not undernutrited, but there is that malnutrition. Malnutrition can be either over or under. So that is that. So low socioeconomic status also, poor people, they don't get enough resource to an aid, because pregnancy comes with all those behavioral and factor that we say, that be social, behavioral, and even physical. So when you're poor, you cannot afford some of this, and their stress can come in. But so some these are so still risk. Okay? Though no, in Kenya people are so poor with the current regime, low socioeconomic status is not even considered, because if you go to Vipingo Health Center, realize that those people are very poor and they are ever already giving birth. Okay, some give birth without even assisted delivery, and they are below 18 years old. So something normal poverty, but I doubt if it should be encouraged to be normal. Now, previous adverse pregnancy outcome, recurrent spontaneous abortion, stillbirth, early and neonates death. So yeah, previous baby with congenital abnormality, those are things that if a mother has a history of, you should be very, very keen, because when somebody is having recurrent spontaneous abortion, there's a question mark about that. Okay, stillbirth, baby dying within that can be a hemolytic disease of newborn due to rhesus factor. So you should get to this and then scrutinize and get it out to understand what can be here hiding below. So preconception care has a positive effect on the range of health outcome, including reducing maternal and child mortality, because most of maternal and child mortality is because there was no that preconception care or initial diagnosis of any underlying condition. Preventing unintended pregnancies. Okay, so after mother has undergone all this sensitization, they get to decide whether it's right for them to go on with the pregnancy or something else. Preventing complication during pregnancy and delivery, preventing stillbirth, preterms, birth and low birth weight, all those on preventing birth defects, preventing neonatal infection, preventing vertical transmission, mother announced to be HIV/AIDS after preconception care. This mother will be actually help and be bridged into a modest way. Now she can protect the baby from acquiring the or getting transmitted to with the HIV. So because of can have the prevention mother to child transmission. So that is that. Now let's see what do we address during this preconception care package. First, we address the nutrition condition, vaccine preventable diseases, genetical conditions. Okay, you know, the genetical conditions can be acquired. Some are transmitted, so they are hereditary. They can be congenitally transmitted. Okay, infertility and subfertility can be addressed. Female genital mutilation, like in community, which still they desire, they have this tendency of, their traditional culture is not yet left. So too early unwanted and rapid successive pregnancy is also checked on. STI and HIV, interpersonal gender-based violence, also mental health in a way that the mother is also considered in case of any other, non-physical or inappropriation of mental in terms of stress, depression, mood disorders. Okay, so these are also checked. Psychoactive substance use, like when somebody is doing alcohol and tobacco use, as a result of alcohol, we get to know that there's some complication that a baby can be born. Some can be born with alcohol syndrome. Okay, so that is also being checked in. Preconception care protocol is what we are now going to see. Now, preconception care protocol, how are we going to go through the process of preconception care? Now, we need to get to know this mother. So we'll start with the comprehensive history, and that history should be family history. We get to know if there was any hereditary condition, be it albinism, okay, yeah, be it, blood grouping, blood group ABO incompatibility or rhesus incompatibility. We get to know medical condition, congenital abnormalities, if any in the family history, there's anybody born with a cleft palate or a lip. Yeah, any cardiovascular congenital disease or cyanotic or acyanotic conditions, such as tetralogy of Fallot, and even there are several. Okay, can talk about patent ductus arteriosus. So medical history, from personal, my family history, we check on medical history. This mother diabetic, have hypertension, that is pressure, HIV, TB, okay, cancer, okay, like breast cancer, cervical cancer, any history of that is getting to not, so that if it is prevention or maybe treatment can be accorded. Surgical history, previous C-sections also gotten to recorded, like previous C-section. Did this mother or does this mother have any history of, cesarean section, that is not normal delivery but surgical delivery? Okay, obstetric fistula repair in previous pregnancy. Okay, if yes, we know very well when if somebody is having obstetric fistula repair, this current pregnancy or maybe expected pregnancy, there's a management protocol that must be followed. Also, previous CS or the C-section, as some indication, we know when to now allow the mother to undergo natural delivery, the vertex delivery, if there is an history of C-section. You cannot do a 2-year gap pregnancy with the first pregnancy C-section, then you do second and the natural delivery. You are prone to tear or hernia or many other complications that can come. So obstetric and gynecological history is also checked. Obstetric and gynecology, we check on the pregnancy wastage, previous preterm deliveries, if there is any STIs, menstrual disorder, prolonged fertility, and all that. Some prolonged fertility is a mother who has stayed even 3-4 years without, 5-10 years, okay, without giving birth after the last pregnancy or delivery. So that can be indicative of many other conditions, so must be also checked. Environmental history, exposure to radiation. If this woman is working on any other, field where there are radiations, like in lead factory or these things to do with the, I mean, can be lead, can be radium. There are all these chemical which can actually attribute to congenital malformation to the baby or acquired condition, or maybe endanger the mother's health at all. So nutritional history, like diet, is also a key thing, because overeating and undereating. So that's also another way. So let's start one by one. All those things I've mentioned, we want to see how we're going to go about the general history. First of all is physical examination. And you remember very well that physical examination has got always two parts: general examination and systemic examination. So physical examination should encompass general head to toe examination. When we talk about the head to toe examination, when you're checking a mom, check from the skull, the nature of the skull, the cranium, the bone, the jaw, okay, the facial bone, the ears. You have to check everything. You don't leave anything. That is why it's head to toes. Coming down, check on the limb, the upper limb and the lower limb, okay, the trunk. We have all these kind of conditions that come on thorax and can hinder pregnancy. Okay, got things to do with scoliosis. Okay, so systemic examination, now you can see check on the respiratory system, endocrine system like thyroid glands, the heart, the breast. Abdominal. Or just say the gastrointestinal system. Yeah, pelvis, reproductive system, if the pelvis is adequate enough or something. And the relevant system will also be based on the history obtained from the woman. And then investigation, mostly what we do is full blood count, random blood sugar, syphilis test, HIV blood group, and ratio. And this is what we call the profile, the bioprofile, or the NNC, antenatal care profile. Okay, so additional investigation are based on the history and examination finding. When you're doing your history and realize that there is a need for culture, you will do blood culture. If you see there is any need for serum amylase, you will do that. If you realize that in your history you need to do lymphocytes counts and all that, okay, so all those on ANC profile, like full blood count, random blood sugars, syphilis test, HIV test, blood group and ratios, and urinalysis, they are key and they are very important to be considered. But then depending on the history, you can still add more. So intervention, after getting all that one, we can see if there is need for counseling. We can realize or establish if there is any necessity for administration of prophylactic drugs such as folic acid, iron, zinc, vitamin A, and calcium. Folic acid and iron in case there is a reduced amount of hemoglobins in the full blood count. Promoting exercise, we can see if there is necessity for promoting exercise, especially for obese and diabetic patients. Management of pre-existing medical condition, we can stabilize medical condition, ensure that medical control is optimal, and with this we can know if it is diabetes. Are we going to manage with the which drugs? Because in pregnancy it comes with a lot of contraindication in terms of pharmaceutical or maybe pharmacology management. Screen for anemia and treat appropriately if there is in case. Check any other drug or treatment used or safe for use in pregnancy and do not affect the sperm function such as the cytotoxic and radiation. Smoking. You can never use misoprostol when somebody is pregnant because that one will be inducing the labor. Where appropriate, refer women for specialized care. So let's check on the antenatal care, or what we call the focus antenatal care. So the model of ANC or antenatal care service among the pillars of the safe motherhood for those undergoing pregnancy. So we have that FANC, just personalized service which emphasize on overall health preparation for childbirth and complication emergency readiness, because during delivery, during pregnancy, those are very key time in the mom's life, that if not handled with a lot of appropriateness, you may end up losing this mother. So when you're preparing for the childbirth and complication, the all that's supposed to be done, that is done under the antenatal care. Yeah. So that is that. So let's see the goals and elements in the antenatal care. Early detection and treatment of problem, that is one. Okay. There are very many. Prevention of complication, birth preparedness and complication preparedness. Okay. Health promotion, provision of skill care at birth. That is all. So all the provision of skill care at birth, health promotion, birth preparedness and complication, prevention, complication, and all those. So what I want you to understand here is very simple. Early detection and treatment of problem. There are problems that we've mentioned, existing medical, surgical, obstetric condition. How are we going to mitigate and change them, or maybe manage them? Those are the things that we're going to see as an objective. Pregnancy-induced condition. Okay. Identification methods. How are we going to identify or maybe detect this condition? First is taking, specifically accompanied by active listening, like the word, tone of the voice, and observe nonverbal cue. Because when you assume nonverbal cues, in this locality in Kenya, poor women or maybe low self-esteem women will not tell you everything. Some of them will be blushing, may shying off. So you have to be very key on body languages and all that. So that is what we encounter actually in most of these setup, especially in health center facilities in Kenya. You get to realize that it's very typically awkward. So there is various screening tests, physical examination where the data is correctly interpreted, active and supportive treatment offered accordingly for anything. For example, HBs, or what we call the hemoglobin level, below 7 grams per deciliter of blood, you will need to refer if you are in lower level. You'll refer if you are in level 3, level 2, level 1, level 4. If you don't have any transfusion setup, you don't need to be there with that patient. Refer ambulance immediately, then refer. Referring does not mean that you need to call the in charge. Please refer. Refer means that you need to take control of that mother's life, because that life is just very as important as your life. Okay, so that is that. Now, and okay, so that is that. So we talk about dietary advices and balance that, and to avoid food items that inhibit iron absorption. That is, of course, there are many that, like alcohol, can inhibit that because of the vitamin. The intrinsic factors and the B12 factors, which if at all are not there, you cannot absorb the iron. Prevention complication. We give tetanus toxide to inhibit maternal neonatal tetanus. I hope you know about tetanus. Tetanus can be actually classified as either generalized tetanus, neonatal tetanus. Okay, and the next one. So tetanus, it's itself brought by maybe an open wound or a cut. From therefore, can get bacteria which is called Clostridium tetani. This one now can result to several systemic manifestation clinical symptoms such as the lockjaw. Okay, the opistotonus, or what we call the hacking of back muscle, hacking, the acute hacking of the back muscle. Okay, can have things to do with the dysphagia, the laryngospasm, and you should know how to manage that. So tetanus toxoid is just for prevention, okay? Then you have hematinics are iron and folate supplementation to prevent anemia, especially when the HB is low. Intermittent presumptive treatment, that is the nets, so that you can prevent malaria. We have intermittent presumptive treatment and the insecticide treated nets. So 18 years and APT. The nets are provided free of charge to all prenatal under five in the designated, that is in Kenya. Then we have the anti-helminthic, minyo, the worms. So you give anti-helminths. The anti-helminths are just drugs. They are used to prevent worms like hookworm, not necessarily hookworm. We can have roundworms, tapeworms. Okay. Bendazole and albendazole are actually the main one in the country. Can have them. Some people call it the ABZ, the 500 mg, 400 mg ABZ. You give that one start preferably, and of course, if there is any symptoms related to ailments, you get to know what to do better. You'll teach regarding good practice of environmental hygiene and share concern. Pica to prevent intestinal. Pica is that tendency of eating. PICA, this pica here. That tendency of eating sand, soil, and all those material. These mothers normally have, low mineral in their body, so they when it rains in our lower land, when it rains, the mother will feel like the soil is smelling sweet, so like it's somehow attractive and good smell, so they'll tend to eat it. It's an indicative of mineral deficiency, so we call it pica. So if they go on, they'll start developing intestinal worms, so you'll need to teach them on hygiene. So birth preparedness and complications also goal. So here you'll be prepared. Components of birth plan be explained, like where she's supposed to be delivering the baby. Okay. She also need to know the EDD. EDD is the expected date of delivery. So she has suitable of her choice. Importance of skill attendant in case of home delivery choices. Transportation means those are all birth plan. Fund for clearing the professional bill, perhaps from government scheme like NHIF. Right now we have SHA and SHE, family saving a community, but companion partner, mother baby package comprised of items for clean delivery and for keeping the unit home. Encourage her to have the bag ready as she waits labor since delivery. So the stored items are pair of sterile gloves or improvised clean plastic bags, soap, clean water, wool, sanitary towel. These are just common. Say kiberiti kit consists of new razor. Call it kiberiti kits. Consists of new razor blades and at least two clean boy string threads, all stored in an empty matchbox. Clothing for baby and mother plus some money. Money is very important, Omera. Money is very important. You guys should be subscribing. Okay. So that is that. So for complication emergency readiness, entail discussion of various danger signs such as vaginal bleeding. If they see anything to do with vaginal bleeding, difficulty in breathing, and fever, let them report or attend to any nearby facility. Severe abdominal pain, you call it the low abdominal pain, the lap, severe headache, blood vision, mostly occurring several preeclampsia. If you get on this is preeclampsia, so it's an emergency, so it's supposed to be going to a facility or something else. Reduced absence of fetal movement, leakage of clear liquor in absence of labor, and persistent vomiting. Those are also emergency. Labor onset before 37 weeks. That one is, premature or preterm labor. So health promotion through sharing on, you get to know about hygiene, balanced diet, get to know ways of infection and condition to control them, to avoid habits that will be disastrous to the fetus, importance of exclusive breastfeeding, postnatal care, and child spacing in future as well. Provision of skill care at birth, maternal as well as the neonatal morbidity and mortality is highly predisposing by self-delivery together with unskilled. So currently, deliveries at health facilities are highly recommended. But due to some inevitable shortcomings, you can get traditional birth assistant, the TBA, they can be used. So therefore, to be efficient in the service, they should be integrated, they should be informed, they should be comprehended at where, and they should know what level to refer to hospital if they see what condition. So those are very important. That is why we need to also do, health promotion in community. So up to there, I think before we start on the visit, I know you know about the four visits. I think that is going to be adequate for examination. We'll be keeping doing this session as when we will be having maternal newborn health to continue from this point as we'll be proceeding.